Good morning, this is Virginia Jupiter and I'm going to perform episiotomy care. So first, let us define what is episiotomy. So an episiotomy is a medical procedure in which the healthcare provider widens the vaginal opening before the delivery of the baby. Now, let us proceed with the equipments to be used. So this composes of the following: kidney basin, ovum forceps, cotton swab, sterile gloves, povidone iodine, hand washing article, draping sheets, bath towels, irrigation solution, bedpan, cherry balls or cotton balls, bin lined with yellow plastic bag, and heat lamp. So let's go now with the implementation.
Good morning, I am Virginia Jupiter and I'm going to perform the episiotomy care.
So before the procedure, we have to explain it to the client. This is done to gain her cooperation. Next is to assemble all the articles at the bedside, or if the client is ambulatory, take her to the treatment room. This is done to minimize time and effort. Next is to provide adequate privacy by using screens, drawing the curtains around the bed, or locking the door of the room. So we have to be very particular, be sensitive to any embarrassment felt by the client. So next is we have to do hand hygiene and follow strict aseptic technique. So this is done to prevent contamination or infection. Let us now prepare the client. So first we have to fold the top bed linen to the foot of the bed and fold the gown up to expose the genital area. And we have to place a bath towel under the client. So the bath towel is being applied to prevent the bed from becoming soiled. Next, we have to cover her body and legs with a bath blanket, position in a corner towards her head, then opposite corner at her feet, and the other two on the sides. Let us now drape the client. So you have to put on gloves.
Place the bedpan for maintaining hygiene and also to ensure patient comfort and efficiency. After that, remove the gloves because it is already contaminated and you have to wear a new one to prevent any contamination or infection.
Wash and dry the upper inner thighs and position the client on her back with the knees flexed and spread well apart. So minimum exposure lessens embarrassment and helps to provide warmth. Next is to make sure that the uterus is well contracted. Palpate the uterus and massage it to remove any blood clots. This is done to facilitate passage of retained lochia. So next is to expose the area, or inspect the area. Observe amount, color, odor, and consistency of lochia. or vaginal discharge. Signs and symptoms of boot infection, pain score, and presence of painful bowel movement. So the assessment of early signs of infection prompts early treatment. When painful bowel movements are experienced, physician may prescribe stool softeners. So next, we have to clean the perineum with sterile wet swab starting at the
Clitoris.
downwards, using one swab once only. So this is done because cleansing of the vulva and perineum and anal region is a means of preventing infection, promoting healing of the stitched perineum and making the patient comfortable. Next is to clean the clitoris, the labia minora, its inner aspect, the labia majora, and its adjacent area, using separate swabs. So this is done to prevent ascending infection into the urinary tract of the client. Using the ovum forceps, you have to pick up cotton or cherry ball soaked with povidone iodine to clean the perineum. Starting from the superior of the wound towards inferior, with one stroke, then discard. So we have to clean the area as appropriate. So one stroke at a time is employed to remove microorganisms and prevent them to spread to surrounding tissues. Next is to remove the bedpan. Turn the client on one side. Clean and dry buttocks. So this is done to keep the perineal area and the anal area clean and dry to minimize the risk of skin irritation and breakdown. Next is to apply dry heat for 15 minutes as needed. So this is done to keep the perineal and anal area clean and dry to minimize the risk of skin irritation and breakdown. After the procedure,
Give things to the client while ensuring that all information remains confidential.
you have to wash and dry articles used, discard all used swabs and pads in a paper bag or dustbin, and do hand washing. Last is the documentation. We have to record the procedure in the client's chart, record the amount, color, and odor of the lochia, note consistency of the uterus, record also if dry heat is applied, record the conditions of the stitches, and report any abnormality if observed.